Good morning, students. Today's class we will see about nursing as a profession. This is a part of management of nursing service and education. You need to find. Nursing is by Virginia Henderson. Nursing is defined as the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death that he would perform unaided if he had necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. The basic nursing principles include safety, therapeutic effectiveness, comfort, use of resources, good workmanship, and individuality. The objectives of nursing: prepare nurses who will give expert bedside nursing care, provide integration of health and social aspects, theory and practice, provide an adequate sound scientific foundation to understand the functioning of the body, mind, the health and disease. Prepare to work cooperatively, develop a sense of responsibility, provide opportunity to develop skills and personality, upgrade nursing as a profession. The concepts of nursing. The task of nursing are to promote health, to prevent disease, to help ill person to healing, to assist dying patient, to pass away with quiet, peace and dignity. The client is a holistic human being including suffering person and healthy person. The workplace is not only in the hospital but also in the family, community, and all society. Nursing is not a science but also an art. Nursing science attaches importance to human beings' living environment and the interrelation between human being and its environment. Nursing science is a gradually perfect and a developing science. Philosophy of nursing: the study of fundamental nature of knowledge, reality, and existence, especially when considered as an academic discipline, a theory or attitude that acts as a guiding principle or behavior. Nursing is viewed as both art and science, reflecting upon the concepts of nursing. Nursing is an applied discipline which expresses itself in practice and that has foundation rooted in scientific or empirical knowledge, theory, and research. Nursing is also expressed as a caring, therapeutic, and teaching discipline. The goal of nursing is optimum client wellness and the maximum level of functioning. The nursing interventions are evidence based and stem from their core knowledge. The professional nurse must appreciate the role of informatics. The philosophy of nursing includes beliefs and values with regard general and specifically man as a learner, teacher, nurse, client and beliefs about health, illness, society, nursing and learning, etc. It includes spiritual, that is religion should serve as the primary integrating factor, moral, nurse has to develop right conscience, intellectual, to provide a systematic development training for the fulfillment of nursing function. Emotional needs: the nurse must be able to function as a mature, self dependent, and responsible individual and must be able to relate well to others. Physical: to promote harmonious development, physical needs to preserve essentials of health. Social: nursing is linked with social culture in which nursing activities are carried out. The functions of nurse, which include first as a caregiver. Caregiver role has traditionally included those activities that assist the client physically and psychologically while preserving the client's dignity. Caregiving encompasses the physical, psychosocial, developmental, cultural, and spiritual levels. Second is the communicator. Communication integral part of nursing roles. Nurse communicate with their clients, support persons and other health professionals and people in the community. In the role of communicator, nurses identify client problems and then communicate these verbally or in writing to other members of the health team. The quality of the nurse communication is an important factor in nursing care. Then as a teacher, the nurse helps the client to learn about the health and healthcare procedures they need to perform to restore or maintain their health. The nurse assesses the client's learning needs and readiness to learn, sets specific learning goals in conjunction with client, and enacts the teaching strategies and measures learning. Client advocate. Client advocate acts to protect the client. In this role, the nurse may represent the client's needs and wishes to other health professionals, such as the client's wishes for information to the physician. They also assist clients in exercising their rights and help them speak up for themselves. Counselor. Counseling is a process of helping a client to recognize and cope with stressful psychological or social problems, or to develop improved interpersonal relationships and to promote personal growth. It involves providing emotional, intellectual, and psychological support. Change agent. The nurse acts as a change agent when assisting others, that is the clients, to make modification in their own behavior. Nurses also often act to make changes in the system, such as clinical care, if it is not helping the client return to health. Then researcher, rehabilitator, and a critical thinker. Leader. A leader influences others to work together to accomplish a specific goal. Leader's role can be employed at different levels: individual, client, family, groups of clients, colleagues, or community. Effective leadership is a learned process requiring understanding of the needs and goals that motivate people, the knowledge to apply the leadership skills, and the interpersonal skills to influence others. Manager. The nurse manages the nursing care for the individual, family, and communities. The nurse manager also delegates nursing activities to ancillary workers and other nurses and supervises and evaluates their performance. Case manager. Nurse case managers work with multidisciplinary healthcare team to measure the effectiveness of the case management plan and to monitor the outcome. Qualities of a nurse. The qualities of a nurse, the first one is a caring nature. Nurses deal with the sick and injured and their families on daily basis and must be able to show that they truly care about the situation. Empathetic attitude. Nurse must be able to put themselves in the patient's shoes to provide quality care needed. Then detail oriented. Nurse must remember to make entries in the patient charts too and bring medication at the correct time. Then emotionally stable. Nurses feel the joy of seeing the newborn as well as the losing the long-term patients. Emotional stability is crucial to deal with the wide range of emotions nurses must endure. Then adaptable. People are unpredictable at the best of times but become even more so under stress. So nurses' typical workday will require flexibility and adaptability. Hardworking. Nursing is never-ending job. It is unusual for a hospital or a medical center to be overstaffed, which of we and more work in each nurse in the unit. Quick thinker. When the nurse notices something is not right with the patient, they must be able to make decisions quickly and put their plans into action instantly, because a fraction of a second can mean the difference between life and death. Physical endurance. Nurses are all on their feet all the day, sometimes 12 hours or more hours at a time, and they are often required to assist patients with active that require physical strength. Good judgment. The nurse must be able to look the patient's current state and accurately assess what is needed, especially during the emergencies. Then good communication skills. Nurse must communicate with the other nurses, doctors, patients, and patients' families clearly. Then responsible. Good nurses know how to perform all their responsibility with the utmost accuracy and detail. They play a major role in assessing and treating the patients, and when they're dealing with the health of the other human beings, so the nurse must be responsibly carry out their duties at all times. So qualities of a professional nurse include truthfulness, love for fellow men, caring, commitment, compassion, generosity, acceptance, assertiveness, punctuality, fairness, self-esteem, tolerance, appreciation, creativity, imagination, confidence, empathy, humor, kindness, morality, courage, accountability, authenticity, alertness, intelligence, efficiency, self-discipline, openness, and independence. So now the five letters: N for nobility and knowledge, U for usefulness, understanding, R for righteousness, responsibility, S for simplicity, sympathy, E for efficiency. So profession. A profession is a calling that requires special knowledge, skill, and preparation. All occupation with ethical component that is devoted to promotion of human and social welfare are called as profession. A profession is an occupation or a calling requiring advanced training and experience in some specific or specialized body of knowledge which provides service to society in a special field. Criteria for a profession: to provide needed service to society, to advance knowledge in its field, to protect its members and make possible to practice effectively. Bixler and Bixler criteria for a profession. A profession is a form of employment, especially one that is respected in society as a honorable and possible only for educated person and after training in some special branch of knowledge. Second, it has own body of knowledge based on social and scientific principles. The members of this profession utilize the knowledge to identify and evaluate the problem. Has service aim as well as academic and theoretical aim. Constantly enlarges its body of knowledge through research in order to improve its service and determine the qualifications necessary for those who enter into practice. It had a code of ethics. Functions autonomously in the formation of professional policy and in control of professional activities. It provides a freedom of action, opportunity for continuous professional growth and economic security. A profession recognizes its responsibility to develop educational programs in cooperation with institutions in order to develop skills and to learn method of services. Characteristic of a profession. The first one, a basic profession requires an external education of its members as well as the basic liberal foundation. A profession has theoretical body of specialized knowledge leading to a defined skills, abilities and norms. A profession provides a specific service. Members of a profession have autonomy in the decision making and practice, and the professionals had code of ethics for the practice, authority to control its work. Service to society, extensive period of formal training, self-regulation, credentialing system to certify competence, legal enforcement of the professional standards, ethical practice, creation of collegial subculture. Then nursing as a profession. Nursing is a discipline involved delivery of the healthcare to society. It is a helping profession. It is a service oriented to maintain the health and the well-being of people. Nursing is an art and science. Nurse originated from the Latin word natrix, that means to nourish. Characteristic of nursing, we have already seen. Nursing is a caring which involves close personal contact with the recipient of care. Nursing is concerned with service that humans to account as a physiological, and sociological organism. Nursing is committed to promoting individual, family, community and national health goals in its best manner possible. Nursing is committed to personalized service for all persons without regard of the color, creed, social or economic status. Nursing is committed to the involvement in ethical, legal, and political issues in the delivery of healthcare system. The elements it's have accountability, autonomy, altruism, association. The categories of nursing personnel are the staff nurses, senior staff nurses, nursing superintendent grade 2, nursing superintendent grade 1, nursing tutor or clinical instructors, principal school of nursing, lecturer college of nursing, assistant professor of college of nursing, professor of college of nursing, principal of college of nursing, senior assistant director of nursing, public health nurse, district family welfare bureau. Thank you for listening.